Koshys Hospital. So the reason I'm addressing you today is May 17th is celebrated as World Hypertension Day. So we all are quite aware about this whole disease called hypertension. So the theme for this year is measure your BP accurately and live longer. The main pointers under which I want to address or speak today would be how we have to, the guideline to measure BP and what some preventive strategies, and if one is diagnosed with hypertension, how to go about. Okay, so we all know that hypertension is a major cause of cardiovascular disease, chronic kidney disease, strokes, and is one of the most important cause of premature death worldwide. So what are the major causes of hypertension? Major causes of hypertension are like obesity, then sedentary lifestyle, certain habits like increase sodium intake, and then there are certain habits like continuous alcohol intake, and it forms part of hereditary disease and advancing age. So these are certain important causes of hypertension, certain of which are modifiable through our lifestyle changes, certain of which are not. So let me just tell you what is the right way of checking BP. So many of us have this digital BP apparatus at home, and we would be wondering how exactly to check BP, whether the lying down position is correct, whether standing position is correct, whether sitting position is correct. So what is the appropriate or near appropriate measure way of checking BP? So one has to sit in a quiet room. There shouldn't be any external disturbances for at least like 5 minutes, and one should be sitting up with the arms hanging down by the side and legs placed down, not in a crossed leg position, and in either of the upper limb or preferably right upper limb, right hand, one has to check the BP. And usual BP that is acceptable is 120/80, and between 120 to 130 and 80 is stage 1 hypertension, and if the BP crosses 140/90, it is called stage 2 hypertension or a full blown hypertension. So is only one reading enough to call or term a person hypertensive? No. In the office reading, that is when anybody comes to my OPD, I would see at least like 3 OPD visits of a high BP reading to term somebody hypertensive, unless they have a underlying hypertensive causes. At home, when would you call somebody hypertensive? So you have to check like at least 3 times a day, the morning and evening, and when the person is not stressed out physically or mentally, for at least a week period of monitoring is required to term somebody hypertensive. Okay, then coming to certain preventive strategies of hypertension, or maybe I can put it as a preventive strategy plus natural ways of controlling the hypertension. So we all, I just spoke about this modifiable causes of hypertension, right? So we are concentrating mainly on that area for the prevention as well as for natural ways of controlling. So main thing is weight loss. So weight loss is the most effective and most preferred method of naturally reducing the BP. Okay, so if anybody is obese or overweight, weight loss itself can bring down BP to a certain extent. Then salt restricted diet. So we all know that salt restricted, or rather sodium restricted diet is very, very important for BP management. But are we aware of hidden salts? So we know cooking salt is one of the major reason for adding salt. So we have to reduce our cooking methods. We have to change our cooking method and add less amount of salt. And other thing is to cut down on hidden salts. Hidden salts are your pickle, papads, your processed foods, and all those to be avoided. Then increased potassium diet. So potassium is like a natural counteracting part for the sodium. So naturally potassium is high in fruits and tender coconut water and ragi and all that, so that intake can be encouraged. Then to cut down upon certain habits like your ethanol intake, so regular intake of ethanol to be cut down. Then exercise, this is also very important. So every day dedicate at least like 20 minutes for a brisk walk or a jog or a moderate aerobic activity for at least 5 days in a week. So that will also prevent or rather bring down BP in a natural way. Then something called DASH diet. So DASH diet you will that is more of veggies and fruits and low in carbohydrates, red meat and dairy. And lastly, something called DASH diet. So DASH diet is more of veggies and fruits, but low in carbohydrates, fats, red meat, and dairy. Okay. Next, coming to if somebody is diagnosed with hypertension, then what to do next? How to go about? So one thing is definitely lifestyle modification is very essential, important, and very useful as well. So like I told, the preventive strategy that works very well fine for the reducing BP naturally also. So once person is diagnosed, he or she should definitely follow these lifestyle modification. Apart from that, stick to the medications as well, because untreated hypertension can lead to some hypertensive emergencies where patient lands up in the emergency with strokes or heart attacks or intracranial bleeds and such things. So it is always better to keep it under control with ideally speaking checking BP at least once a week at home, and or coming as a regular follow-up to the doctor's office. And then another important thing is your annual health checkups. Okay, so once a patient is diagnosed with hypertension, this becomes very essential to early diagnose the end organ damages. So end organ damages are like damage to kidneys, damage to eyes, damage to heart. These can be picked up early, or rather monitored whether if there anything is starting. So annual health checkup for hypertension includes monitoring of your cholesterol levels, a lipid profile, monitoring the kidney function tests with checking out whether there are protein leak in urine, then monitoring the heart functions in form of echo, and monitoring any eye changes, that is retinopathy changes in the eye by annual eye checkup. So this essentially forms the annual workup for a hypertensive. So let's all be very mindful about hypertension, mindful in terms of our lifestyle changes, our habits, as well as the medications, and let us try keep learning more about hypertension and be aware so that we can live longer without much complications, and we can live along with hypertension and help others who are hypertensives amongst our kith and kin. Thank you.